Well, hello, everyone. This is Dr. Amigues, your friendly rheumatologist and host of the On Average MD podcast. And today we have a treat because we are joined by Dr. Braun, who is a comprehensivist. And I will let him explain to you what that is. But he has a direct care, primary care, a direct primary care practice in the greater area of Denver. I am so excited to discuss a lot of things with Dr. Braun. One of them is the science of longevity, as well as why he started his DPC practice. So without further ado, Dr. Braun, thank you so much for being here. So what is a comprehensivist?
Well, that's a great question. Thank you, Dr. A. This is fun. I always love doing stuff like this. It's fun to get to know other docs, other physicians, other healthcare professionals. And yeah, I mean, I like to, people always ask, people who are friends and neighbors who are not in healthcare, oh, what specialty are you? And I used to think, primary care is my specialty, but, by definition, not really, because, rheumatology is a specialty, cardiology, GI, all those things. And so I heard a podcast a long time ago about someone called primary care more of a comprehensivist, right? So we might know a mile wide and an inch deep about a lot of things, and so we know what we know our little niches, and that's how I've kind of built my practice and my education of exploring what I love, what really gets my juices flowing, and then calling in the specialist like you whenever I might need a little help. And so when a patient walks in on my door, they're totally undifferentiated. It could be any diagnosis for anything, and exploring and getting down to the nitty gritty, and then getting a good diagnosis in my mind, and then if I need help, calling the specialist. So that I like calling myself. It's a proud thing that I call myself a comprehensivist. It doesn't really make sense, but it sounds cool, right?
Yeah, I think it sounds cool. I say comprehensive rheumatology, so I get it, and it's actually quite interesting. And this gets to the second question, because the reason I opened On Average MD was that I was tired of seeing only a part of the patient. So people at this point, the audience already knows my story. So we want to hear about your story. What got you to open a DPC practice?
Yeah, that is a fantastic. I love this story. I love talking about myself. So thank you for letting me talk about this stuff. No, it all started back in medical school. I have no family members in medicine. I have one uncle who I wasn't really close with growing up, but I have no family in medicine. I was kind of the black sheep of the family, wanting to be a doctor. So I had no outside influences telling me, you should do this or you should do that. So I went to medical school as a blank slate. I always had this entrepreneurial itch that I couldn't really scratch. So I knew I wanted to open my own practice in something. And then as I started exploring all the different specialties and doing rotations and learning about everything, then primary care spoke to me just on multiple levels. And so I started working closely with primary care docs, and then realizing there has to be a better way than seeing 50 patients a day and, in the hamster wheel. Came across direct primary care, went to a few conferences, started talking to a bunch of people, directly asked people to be a mentor for me, which, looking back, was a little bold and a little weird, but I love it. They were still good friends. And then during residency, I told everyone that I was going to open my own practice, and they thought I was nuts. And then kind of accidentally, I opened the practice during residency, and the ball just started rolling. The snowball grew, and then by the time I finished residency, I had just over 100 patients that were signed up with me. And so it was, I saw that, normal primary care docs were not terribly happy in their careers, and then there had to be a better way. And so I did some exploration and found direct primary care, and I'll never go back.
Yeah, and I think that I was talking to some other docs recently, and we were thinking that this is probably the future of how we heal healthcare. But without going into this, one of your area, and I like to call them a zone of genius, because I think we can have many area of interest, but where is it that we're really good at? And when we talked, the first time we met, we talked about the specialty of longevity. And, as baby boomers now are retired or retiring, And those are our parents. I mean, I see my dad is like, I think he's about to be 77, and he's learned acupuncture. He's so there's so much vitality. Or like one of my mentors is 88. I for some reason I thought he was still 85. And then he was like, no, I'm 88. And I'm like, oh my gosh, like, it doesn't look like you're 88. So, right. So tell us a little bit, and I'm sure by the time we are 88, we will look younger, I'm hoping, or we will feel younger than our parents and, and mentor figures that are already in their, late 70s, 80s. What is the science of longevity, and what can you maybe tell us a little bit what we can do to get the best of our body in a good sense, to protect our body, to take care of our bodies?
Yeah, no, that's a fantastic question. I mean, it all goes back to in this model that you and I do, then we have time with our patients, right? My patients sit right there on that couch, for 90% of the visits. And we have the time to talk. And what I found was a lot of people, they live very healthily, especially in this state. A lot of people are very healthy. They go outdoors, they move, they eat, they're conscious of what they eat. And so from a normal primary care standpoint, then everything checked out and, hey, you're great, you're up to date on everything, keep doing what you're doing. But then people kept asking, hey, what more can I do to really optimize my health? And so, I've listened and read to all of the Peter Attia, everything he does, and some of the other guys out there. And I was thinking, okay, maybe there's something here that I can incorporate into the direct primary care model since we have the time. I've kind of see it as the primary care is the base, and then adding on to the longevity piece. And I've learned that people really respond well to wanting that extra blood work for the cardiac risk. They want to do a full body MRI. They want to see their VO2 max. They want to see where they're at, and then have some objective data to trend. And so it's really been a blast over the last, I don't know how long, just diving into that and learning alongside with patients and seeing what works for some people, what doesn't. And almost, I'm not going to say cutting edge or fringe medicine, but definitely outside the quote unquote check all the boxes for all of your USPSTF guidelines in primary care. So go ahead.
Just because the audience of this podcast sometimes goes beyond the US, and so America, I'm starting to use a lot of abbreviation. So just to be clear, you're saying, well, so there are recommendations of being updated on vaccinations, on screening for cancer, on making sure that your cholesterol is well controlled, things like that, right? And then you're saying that some patients are saying, well, and the population in general, I think, is really interested in that, of how do I actually get even better? How do I prevent anything that's preventable? And how do I make myself as healthy as possible? And then you mentioned the full scan, full MRI. And to me, I'm like, well, that's kind of a strange thing to me, because I was taught that you don't do a test unless there's a reason to do that test. So I'm just wondering, what's the goal here? How is that associated with longevity?
No, that's a fantastic question. And one that I honestly professionally have struggled with a little bit. I've thought about, because I was trained that way too, of don't order something unless there's an indication to. And I've come to terms that might be a little bit of a reactionary, and a lot of patients want prevention, right? And so I don't order all these things for everybody just who walks in my door. It's a specific conversation of, hey, we can do the blood test that tests for precursors of 75 cancers, but just know that if anything pops positive, it's going to be hard to follow up for 10 years, because it's such an early on test. We can do the full body MRI, but if anything pops up, it could be benign and be totally normal, but it's going to be on your mind. You might cause you some stress. And so that's why I kind of see it as we have our normal primary care, and this is above and beyond. That's a little bit on the fringe, a little bit on the outside. And patients sometimes are like, yeah, let's do it. I really want to know. Other patients are like, no, you're right. I like that discussion. I think I'm fine where I am. And so outside of testing, then longevity is life is motion. Motion is medicine. It all starts in the kitchen, what you put in your mouth, what you consume, and having the time to really go through and be an advocate for my patients makes a big difference in their health and their health span, pretty much.
This is such a pet peeve. How do you call that? Pet peeves? I can't remember that
Oh,
expression.
yeah, that's right. Yeah.
It makes me laugh every time. So I'm French, right? And I didn't realize how much food is like it's part of your it's part of your life in France, right? And I think that it's part of your life here in the US. It's just such a different approach to food here. And it's really funny because I trained when I was in New York City. I trained in Harlem, and there was a lot of fried chicken.
Oh yeah.
A lot. And honestly, that's how I discovered it. I think it's delicious. I don't feel great after, but I think it is delicious.
Yeah.
And here, next to Boulder and some areas of Denver, and especially with a lot of my community that's a rock climber, food is about what you're eating. Don't eat this, don't eat that. And I'm just like, okay, food is for pleasure. What's going on here? And the reason I'm sharing this is that I think sometimes when we're talking about longevity and what we're eating, and I think that that's such an important concept, and I share also this with my patients because there is pro-inflammatory diet and anti-inflammatory diet, but sometimes I wonder if we almost remove the pleasure of eating, by being so oh my goodness, you need to eat this and not this. And so I wonder, how do you make sure that your patients also enjoy what they're eating?
That's a good question. I haven't really thought about that specifically, but a lot of people come in for weight loss, right? I'm the first point of contact in the medical system for, hey, how do I lose weight, right? I might not be the last point or the end all be all, but a lot of people say, hey, what's the path here? I say, hey, whatever diet, I really don't like the word diet, but whatever nutrition plan you're on, and if it works and the one that you can stick with, that's the one you should go with, whether that's carnivore, keto, vegan, plant-based, whatever it is. If it's the one that you enjoy, that's the one you should stick with, because that one will show the most benefits for you, because you're going to be on it for more than a week. And so having people enjoy and not have that toxic relationship with food of oh, now I can't eat sugar, it's we need sugar, just not highly processed sugar, And so it's definitely adding in that. I've never thought of it as how do you enjoy food, but definitely how can we avoid you hating food? So it's a funny game to try to get that into people's heads.
Yeah, no, and it's something that I never had paid attention to, I'll be honest, because I think that in France, the vast majority of people have a pretty healthy relationship with food. It's not perfect. Nothing is perfect, but it is true that when I came here, I had the people who were gluten-free, the people who were carnivore, the people who were dairy-free, the vegetarian, the vegetarian, the pescatarian, and I was like, wow, there is so many nutrition restriction, and it was a very interesting switch. And I'm myself trying to be more whole food, plant-based, right? So I'm buying into this because it's well, that's healthy, that's healthier. But yeah, I was wondering how. Thank you for answering this.
Of course, no, you too.
Yeah. So you also mentioned the the VO2 max, and so do you when do you do that? I'm assuming it's for people who are, and maybe you can explain what that is for people who are not in medicine.
Yeah. So from VO2 max is something that endurance athletes and other athletes too use to measure their cardiovascular health. How good of shape is your heart in, pretty much, and how easily and efficiently can oxygen be sent to where it needs to go. And so there's various places that you basically hop on a treadmill or a bike or something to get your heart rate up, and you have a big mask on, and they test it. And It's not exactly an enjoyable test just because you're pushing your body all pretty much to the max. There's ways to scale the test a little bit. I don't do them here in office, but there's tons of places around the area that you can go to, and it's relatively affordable. But the research is coming out that VO2 max is one of the best indicators for cardiovascular risk in the future. And so if you can keep your VO2 max at a certain level based on your age, then your risk for having a major cardiac event decreases exponentially. And so it's better than any medication. I don't know if I'm allowed to say better than any medication yet. However, it is healthier than taking a pill every day and then still going and sitting on the couch for 12 hours. So
I love this. I'm interrupting you because it's such an interesting concept, right? To say, well, so right, I was asking you this question of like, look, why do you do tests when we were taught don't do a test unless it's needed? And now I'm realizing, as you have realized probably before me, that data actually helps patients. And maybe the VO2 max is not something that we're going to act upon from a physician perspective, but that could be a data point that we share with our patients. So we're like, hey, you can push this a little bit more, or, this is a very good VO2 max, continue to do the exercise you're doing, or things like that.
Yeah, no, that's a fantastic way to put it, because a lot of patients, they say, hey, I want to get in better shape, but there's not something you can track with that. Sure, you can look at the scale, but that's not the same for everybody. Sure, you can, my clothes fit better, but it's not like you can achieve something, because there's never a finish line for getting in shape, right? And so VO2 max, you can say, hey, my VO2 max is 50, and by the end of the year, I want it to be 52 or something. Like, that's, a lot of people really appreciate that objective, like, checkbox approach. So it's a great way, almost to incentivize people to move more, and to, I'm not going to say exercise, but be outside and get their body moving. And so it's definitely a motive there. That's a great way to think about it.
Yeah, no, that's really interesting. I guess if I were to do the VO2 max, it would push me a little bit more, because I'm not a runner, for example, and I bet I could be after seeing the VO2 max. Maybe I will, I will get that. It's really interesting. And then, so you mentioned movement, which I think is great. Nutrition choice, making sure that you're updated on up to date on everything that needs to be done. Is there any other, not hack, but anything else that you would that you look into when you're with patients who are interested in that?
So there's some more blood work, and so there's things you can look at, like fasting insulin resistance, things like that. There's all of the ApoE and ApoA's. There's the CRPs, the cardiac CRPs. There's things that you can add on to the quote unquote normal annual panel, that you kind of just start building this picture of this person's health, and it's very unique to that individual sitting right there on that couch, right? And saying, okay, this is kind of, you're doing everything great, you're very healthy. Here's might be one place that you could improve on. Again, I feel like longevity is almost splitting hairs a little bit, because it is pushing it to that next level, and it takes a little bit more effort on the behalf of the patient to really, but they're asking, so I'm gonna tell them, hey, we're splitting hairs. But just there, I kind of have not a program, but a list of things that we do, and a couple optional things. Like the full body MRI is a little expensive, but some people don't want to do that, some people do. And so kind of just build that whole picture, and then pick and choose where they could focus on to improve. VO2 max being one, nutrition being one, other things like that.
It's really interesting, because I'm a fan of science fiction, and I'm just picturing, the full body scan with the test, and like, okay, here is where you're at from a health perspective, and this is what you can do. And it is interesting. I think that I don't know that I buy it completely, in the sense of I guess I'm very French in that way, or at least I'm gonna say that it's because of French, because there's this thing where it's like you're trying to have so much control over every single thing, and put so much how do you call that,
Emphasis.
Emphasis on test. When I almost feel like we should just listen to our bodies and just be like, okay, what is your body telling you? And I'm so big on that. And what's your intuition? And of course, if there's someone that has intuition, like something is wrong, I want a full body MRI. Completely supporting of that. But I it's really interesting, as you mentioned in this, I cannot not see science, sci-fi sort of movies and books, and so it's really fun. But at the same time, I'm like, oh wow, we are there already, right?
Yep. I'm reading a book. I guess it's a whole series. I'm rereading it, and in that it's kind of science fiction, and they have a handheld MRI, and so they just run it over the body, and it like goes into their contact lens, so the docs can see it. And I'm like, that would be so cool if I had that. That would be awesome. I could just be like, yep, you're good.
We have the ultrasound, right? So we have literally an ultrasound that I like. When I pick my ultrasound that's handheld and on my phone or the iPad, people are like, what? You can see my joint with that. I'm like, yeah, I can see the inflammation in your joints with this. So yeah, there's so much. It's really fascinating how science fiction, I don't know if science fiction gives ideas or if it's just that we always have those ideas and we just make them happen in science fiction writing.
Yeah, it's only a matter of time before I have my own handheld MRI. I'm just holding out hope. Sometime in my career I'll have it, but we'll see.
I don't know. Yeah, it's really interesting. So, this is a podcast about hope, right? So it's hope driven by science. I like to ask people to come on the podcast to share with us a history of hope. Do you have a good history for us about your patients? One of your patients? I'm sure you have many.
Yeah. Which one do I choose from? Yeah. So it was last summer. One of my kids was on their little kids soccer team, and they were running around. We had practice. I was just dad for that night. I wasn't coach. And on the sideline, they're all with their friends playing soccer. And later that evening, one of the parents calls me and said, hey, my son, who was just at this soccer practice, his heart rate is like 220 right now. And I was like, yeah, it's probably not real, but sure. They're like, no, on our Apple Watch, it's 220. I was like, okay, make sure it's like on the wrist, right? Make sure, you're sitting resting. He's like, no, I'm feeling the pulse, and it's like a hummingbird. I was like, oh, okay, well, that's maybe something's going on here. So, it was like 7 or 7:30 at night. I met him here at the clinic. We got an EKG, and by that time his heart rate had come down into the 150s, so I could read it. The EKG was a little bit easier to read. And I actually have a pediatric cardiology friend I was in medical school with. So I texted that person the picture with patient consent, a picture of the EKG, and she said, oh, that's actually Wolff-Parkinson-White, right, disease. And pretty rapid heart rate. So needs to, if they're asymptomatic right now, call Children's and say, hey, we need an appointment first thing in the morning with the cardiologist. So I did that, got him in first thing in the morning, had an ablation the next day, and the kid's totally fine now, right? And so I love that from a physician standpoint of they got in right away. It wasn't just because I knew them. If they were one of my patients, then I would have got them in right away anyway, like that night. We got them the care they needed, and he was back on the soccer field in a couple of weeks, and I love remembering that story, because from a direct primary care standpoint, that wouldn't be possible. They would have gone to the ER, they would have spent $10,000, all that stuff. So we saved him a ton of money, saved him a ton of time. And I mean, yeah, sure, we saved his life, maybe not imminently at that moment, but it was tons of fun. So gives me hope to keep practicing medicine, that we might catch something like that in the future.
Yeah, absolutely. That's so wonderful. It's always like that, right? And so, well, after this really good story and all the things that you've shared, I'm sure people are going to be like, where can I find Dr. Braun? So where can we find you?
Oh, I'm all over, all over the place. So, Facebook, Instagram, LinkedIn, that's all the personal, I guess the business pages. My clinic is Strive Direct Health. I'm striving for, health, Strive Direct Health. And I love chatting with anyone and everyone about, all things health. And so people reach out all the time on all the different platforms, and we have calls just like this, and chat and touch base. And I learn a lot from a lot of different people. So
feel free to reach out. If you want to become your patients, where should they go?
on the website, Strive Direct Health, then there's a little join the family button at the top. You can click that and it takes 2 seconds to fill out the form and you're officially part of the Strive family.
Okay, wonderful. And we'll put all of this in the show note, of course. Well, Dr. Braun, it's been such a pleasure. Thank you for being roasted by me with all those questions.
Yeah, thank you. This is fun. I really appreciate it.
Yeah. And then, well, everyone, if you're looking for a direct primary care physician, look at the Strive and Dr. Braun's office. And if you are looking for a rheumatologist that's outside of the insurance world, I'm still taking new patients on Average MD. And you can give us a call or just email us. All right. Well, Dr. Braun, thank you again so much for being here. And everyone, have a great week.